the aim of the guidelines is to ensure the integration of policies which translate into increased physical activity in everyday life, taking into account that there are a variety of policy areas where you can do something to allow people to be more physically active. The guidelines are not about what individuals should do. We do not want to supersede the recommendations of the WHO. Also, we recognize that individuals may not always actually be in a position to do what is recommended. Therefore, our guidelines are addressed primarily to policymakers in member states as inspiration for the formulation and adoption of action-oriented national physical activity guidelines. But there is also a general invitation to all relevant actors, including those in civil society, to pick up from the guidelines what they can use in their work, because we have it put out in quite simple and comprehensive terms in the guidelines what could be done and what should be done. Back in 2006, Member State sport ministers specifically asked our EU Working Group Sport and Health, which is a voluntary and informal working group because we still don't have any official EU working groups in the field of sport in the absence of a treaty-based competence. They asked this Working Group Sport and Health to prepare such guidelines, and the Commission backed this with a formal promise in the white paper to have them ready by the end of 2008, and we did it on time. The white paper says before the end of 2008, and they were adopted in November 2008, so we were really on schedule. Or, as they would say in the industry, just in time. So we're quite proud of that. But now that I've told you about where they come from, what the philosophy is, you would certainly also want to know something about the structure of the guidelines. First of all, they can be found on the Sport Union's website. That's important. There is a website on the which you can access from the portal Europa. You can also just write into your search machine European Commission Sport Unit, and you will find the Sport Unit's website, and there you will be directed easily to the guidelines. The guidelines are available there in English, in French, and in German. There's much of the document which you may take inspiration from. There are different policy areas addressed to different decision makers. The idea is, with this document, that it should be easily readable, not like certain very respected texts published, for example, by the WHO, for example, by the Surgeon General. These documents are very fine documents from an academic point of view, but they cannot be easily translated into practice by people who are not medical doctors themselves. Here we wanted a simple action-related document. Different policy areas, different sectors and different levels. So the idea is it's both for the public, for the private and for the voluntary sector. It's for the national, the regional and the local level. And if we say the local level, they should be understandable not only to people in a city hall who work in the public health field, but also to those who work in parks and recreation or children and families. The aim is to define policies that would help Europeans, again, to be more physically active in their daily lives. We have been supporting some research in the past about young people's changed lifestyles, sedentariness, increasing obesity levels, and it became clear that whereas it's important to tackle the problem from a public health and consumer protection side, it is equally important to address it by increasing physical activity. The guidelines are structured by policy fields, policy areas. You may be surprised when you look at the document to see that some sections are much longer than others. This reflects simply a very pragmatic working method. We were working with a scientific committee with 22 professors, all outstanding academics from across the EU. We had 2 face-to-face working sessions, and we worked a lot before and after sessions. They were all asked first to write drafts on different topics that they were specialists on, sometimes one at a time, sometimes 2 or 3 or 4, co-authoring a text, and we condensed them. And what has survived is that which is absolutely the best tested takes the best tested recommendations in the area. And that's why some of them are longer than others. You will also see that some national guidelines that have come up meanwhile, such as the Plan Integral from Spain, published last year, is more comprehensible. It's got a section on disability, which we did not have, and that's a sign that it is moving on and it can be done even better. But the EU document was, of course, supposed to address the issue at a rather generic level, and it was better to have a short and crisp document rather than a longer one, which might sometimes have a bit more precision, but where it could then be more difficult to reach consensus about different passages of the text. I have tried to select some of the recommendations which I think are particularly interesting to people who may be attending this conference, either people from cities, local authorities, and other metropolitan areas or rural areas, or people from the sport movement in the widest sense. But these are only some of them, because there are about 40 numbered guidelines in total. Guideline 12, low barrier, health-related exercise programs, targeting as many social and age groups as possible. You may see this as a recommendation addressing the work of sport organizations, but you may also very well see that as relevant to the work of cities or districts. Guideline 13 clearly addresses sports organizations. Quality tested and cost-effective programs for prevention and health promotion. Also about cross-sectoral cooperation between different sectors, sports sector working with the health sector. Guideline 25, plans at local level for appropriate infrastructure to allow citizens to cycle to school and to work. I'm sure Gil Penelosa would not disagree with me on that. Some of the things are, of course, about stating the obvious. You may say, so do we need the EU to do that? Do we need 22 professors to tell us that? Yes, you may, because that means that we have here a list, a qualified list, based on a strong consensus, about the kind of minimum norms. And we hope that in future we may have some kind of monitoring mechanism at EU level. Not a binding monitoring mechanism, but a soft monitoring mechanism. Guideline 26, active commuting. It's a bit the same. Here it's very much about the town planning perspective. Guideline 27, investments in infrastructure. That's about actually building the bike trails. Guideline 28 is very much about town planning. There are different ways of planning new neighborhoods. It's not always so common in Europe that you plan entirely new neighborhoods, but it does happen. In Copenhagen these last years, they've been building next to the airport a completely new settlement, a new district of Copenhagen, and it's exciting to look at. When you are engaged in such exercises, of course, you have a unique opportunity. A unique opportunity to do even better than you did previously. And it's important that there is a guideline that addresses the needs in this connection. They should also consider distances and ensure opportunities for walking or cycling from home to train stations. Consider distances. It's about also being realistic. Give people a realistic choice. It's nice to say that everybody can take their bike from Amager to central Copenhagen, but maybe it's more realistic for some people that you simply make it easier for them to use a multimodal transport structure where you use your bike some of the way and the train some of the way. Guideline 29, local government should consider cycling as an integral part of town planning and engineering. They encourage to exchange best practice throughout the EU. That's certainly also a field where we could do more, and we could do more by supporting networks where they exchange about what they do. Guideline 30, public authorities responsible for traffic police services should ensure appropriate levels of safety. It may be surprising in a document of this type to find something about the work of police services. But it is relevant. And And we heard Philippe Rosa talking about some of the unintended effects when you get really many bicycles out on the street. And it may be that it is necessary for police departments to be a bit more active. Because otherwise you kind of get a kind of vacuum. You have certainly in cities where there is no antecedent in terms of bicycle culture. I think that's the case in Brussels, where people have started biking in the last 10 years, but there is no bicycle culture. And you may need to educate people. Okay, as I said, you can find the document online, so I'll not go more into detail with that. In the end, I'll return to the title of my presentation, Who Takes the Lead? And we may be able to distinguish implementation of different types of initiatives via different actors. Via Member State Sport Ministries. Why do I start with that? Because the document was requested by Member State Sport Ministries, then via the EU, starting in different council formations, and finally via cities and sports organizations, and maybe that's the most exciting because that's about you and your friends. I will not be too detailed about these different types of implementation. Just say that, of course, we can start with the Sports Council to get the Sports Council now, but we should still remember about the Public Health Council, the Transport and Energy Council, and possibly other council formations. But there's a lot that can be done in Brussels in terms of monitoring if there is a political will to do that. The Council can decide that it will return to the matter every 6 or 12 months, and that Member States should submit progress reports and tell whether they've done something or whether they've again not done something. And then you may have a situation where it's a kind of peer review. You look at what the others do and you want to do better. A new beginning with the Lisbon Treaty? I hope so. We can have a political cooperation, and we will hopefully have a program. We have had this year's call, which is a small one with not a big volume, but I'm proud to say that of the 4 objectives found in this call, 64% of the applications were for the first type of project, promoting health-enhancing physical activity. We had 207 project proposals in total. We've had a lot of work evaluating them, but we have taken care to ensure that every project gets the detailed analysis it deserves, and we hope that in the future we'll be able to support more than this year. So thank you for your attention, and looking forward to the discussion.